morning.
Thanks, Joan. Good morning. So we are seeing the virus active in a number of places, as has been mentioned: Ballon, Bacchus Marsh, Barwon Heads, Phillip Island, and in suburbs across Melbourne and in some of our biggest sporting stadia. We have multiple sites of transmission and more than 160 exposure sites across Victoria. That includes restaurants and pubs, sporting stadia, MCG and Amy Park, the Cerberus Naval Base, and then multiple schools, so Bacchus Marsh Grammar, Barwon Heads Primary, St Patrick's School and Trinity Grammar. The infection patterns here and overseas tell us that younger adults, teenagers and people in their 20s and 30s absolutely become infected, especially with this Delta variant. There are young adults in hospital right now around the world, including in New South Wales with COVID-19, some with very severe illness. COVID-19 can infect anyone, anywhere. Yes, there are higher risk settings. Yes, there are individuals who are at greater risk of more severe disease, but anyone, anywhere can become infected. Any household, any workplace, any part of Victoria. The Delta variant is different to previous strains we've seen before. It's becoming the global predominant strain, and we're really seeing a third wave globally with the Delta variant. It is more infectious. It's infectious earlier in the incubation period, and the incubation period might even be shorter than the average of 5 to 6 days that we've seen with other variants. And so that becomes a big challenge from a contact tracing point of view and from the transmissibility of that virus. So we need to protect all age groups, and effectively that's by getting vaccinated as soon as you're eligible, understanding that not everyone's eligible right now, but as soon as you're eligible to get vaccinated. I've booked in for my second AstraZeneca jab for later this week. So I do encourage everyone who's had their first vaccine, whether you've had Pfizer or AstraZeneca, to finish the job, get that fullest protection you can by getting your second dose. We do continue to see a great response to vaccinations. We're all clear that that's the way out of this pandemic. There were 19,237 Victorians who came forward yesterday to get vaccinated. That's a fantastic number. There are still spots available for Pfizer vaccinations, so over the next 3 weeks there are 35,000 spots still available for dose 1 of Pfizer, and there are 69,000 spots still available for dose 2 jabs. In addition to this, we've prioritised 10,000 Pfizer appointments for our most at-risk workers and residents, regardless of age, and there's still plenty of capacity for AstraZeneca as well. We have prioritised all healthcare workers, all hotel quarantine workers, including the medical and support staff, as well as the ADF and Victoria Police personnel. All international border workers, including our airport and marine port staff, as well as those working in the red zones, such as authorised officers, Australian Border Force, and our COVID testing staff. All household contacts, so those aged 16 years and over, of our hotel quarantine and international border workers. And then, of course, residential, aged and disability care workers and residents. So all of those are prioritised for vaccine. Those appointments for people in these categories can now be booked through the coronavirus hotline on 1800 675 398 or via the online booking portal. Our frontline workers and those living in vulnerable settings are at the greatest risk of transmission. Finally, please, as we've said, check that list of exposure sites. Check it every day. It's updated multiple times per day, over 160 sites now, but there'll be new ones today, there'll be new ones tomorrow. It gives our public health team that vital information to chase the virus down. But we want to get ahead of it. It's not just about keeping up. Drive this completely into the ground, and our public health teams are working day and night to keep us safe. My final advice, as we stand today with an escalating situation, is really follow those lockdown restrictions. Only going out for those 5 essential reasons, and only really as essential. Please check the exposure sites. Please get tested if you have any symptoms whatsoever. Get vaccinated if you're eligible, and and you are free of symptoms, don't go to a testing site if you've got any symptoms at all, or to a vaccine site, sorry. And if you have to isolate, you must isolate. That means not going out for anything other than emergency reasons, in which case you should be calling an emergency number and identifying yourself as being in quarantine. And check in with those QR codes everywhere and every time. Thank you.
So can we just very quickly?
I can carry on?
Yep. Can you just clarify the current advice to household contacts of anyone who's been to a Tier 1 site?
So household contacts who've been to a Tier 1 site need to quarantine for a full 14-day period. That's regardless of the testing results that they get over that 14 days. They'll be prompted to get a test early on, because if they're identified as a case, they're managed differently. But even with a negative test, if you've been to a Tier 1 site, you have a full 14-day period of quarantine that you must complete.
One of your new Tier 1 sites is a gym in Richmond. 2 separate days, appears to be 2 separate classes. If Delta is that infectious, how worried are you about those 2 exposures?
Yeah, look, it always depends on the individual who's been there. Are they right at the beginning of their infectious period? Are they maybe one of those fortunate individuals who's not as infectious? But the Delta variant has people who are more infectious more often. So, of course, it's a risk. But any of those exposure sites are a risk. We flagged many times before that indoor areas with exertion, especially with no mask wearing, if that's the case, are an even greater risk. So everyone needs to check those exposure sites and to quarantine appropriately.
Just in Richmond, we understand there is an apartment block that's been visited by DHHS officers in hazmat suits. Is that inner city Richmond apartment block in lockdown?
So it is a site with a case. And Jerome might be able to give some operational details on the response, but it's effectively the response that we've had for other housing settings where there are multiple individuals nearby, but they're being supported to be tested, and they'll need to quarantine for that period of time as well.
And just on another case, apparently we've also heard that there are 3 clubs in Queensland that have players and staff in hard lockdown because they unknowingly visited Tier 1 sites in Victoria before flying north. Do you have any information on that?
I don't have information on that, but look, there'll be a number of Tier 1 sites, as you know, over 160 exposure sites. Many of those are Tier 1. People will have travelled back to areas in regional Victoria and potentially interstate. So especially for those attendees, this is why the AAMI game, the MCG match, because it takes people from across the state and across the country, means that there will be postcodes around Australia where people need to check those exposure sites and quarantine appropriately.
Just on what you were saying about vaccines, you talked about getting the second AstraZeneca jab. Are you recommending that people get that second jab earlier than 12 weeks?
Not outside of the ATAGI advice. The ATAGI advice, as I understand it, is for those areas with significant outbreaks at the moment, can bring that second dose forward. I'm having mine at the 12-week mark. There is consideration when you've got a significant outbreak with large numbers with transmission to have that shorter period of time. But go to the ATAGI website for that specific advice as it relates to current outbreaks.
And you talked about younger people getting infected, and people like teachers and young people who go to sporting games and to pubs and things. These are all people reflected in today's figures. How frustrating is it that in most cases those people are still not eligible?
Look, we would all love all the eligible Australians, all Australians 16 years and older, to be vaccinated by now. That's not the case. It's not going to be the case immediately. We've got a supply constraint. That's the reality we have to live with. Vaccination is our primary means of protecting ourselves and protecting everyone, but it's not the only means. All those other tools of physical distancing, of wearing a mask, of checking your exposure sites and then isolating, quarantining as appropriate are those other measures that we put in place before, prior to vaccines even being available, that has defeated this coronavirus and all the outbreaks that have been associated with it. So yes, it's frustrating not to have everyone vaccinated who are age eligible, but we've got to use all the tools available, and we can still turn this around. Even with 12% fully vaccinated in Australia, we can still turn this around. But of course, getting vaccinated now, every little bit is going to be that additional layer of protection for everyone.
Sorry, we're seeing new generations of transmission almost every day now. You're saying the incubation period appears to be a bit shorter. How far off are we from having any confidence that we've got everyone in quarantine who needs to be? Is that going to be the only point at which we can exit this lockdown, when you're fully confident that everyone is in quarantine who needs to be? Are we days away from that, or does it seem to be pushing further away?
It's always a day-by-day prospect. Obviously, we've got a number of people who've had some of their infectious period out in the community, but that 1.7 days is a very small figure when you consider that we take the infectious period 2 days prior to symptom onset. And so it means that there are a number of people who've had the majority of their infectious period in isolation, in quarantine. That's a great sign. But yes, we want to get to that maximal number of people who have their entire infectious period in quarantine. And that means capturing them as primary close contacts and having them in quarantine at the earliest possible time. That's why it's so critical for everyone to check those exposure sites, even as we're reaching out to people, as the QR code data comes in, as the lists of staff at those exposure sites are provided to our contact tracers. We will drive that number down further so that we've got fewer and fewer people who have any infectious time in the community. That doesn't have to be at zero. We can still wrap a response around people who are infectious in the community, but it becomes much harder if they've been to a number of sites, if there are a number of others exposed. But that's the exact purpose of the lockdown, to reduce your unique close contacts from pre-lockdown, which averages about 100, to the 5 or 6 that it is when we're in lockdown. It's a huge difference to how we can manage contact tracing and how we can wrap the public health response around this.
And Professor, on those people who are in isolation when we catch them, are you finding that what's achieving that is the lockdown, or is contact tracing actually keeping up with this? How far behind are we on the contact tracing?
Well, we're not far behind, in as much as we are going, as Jerome said, as fast as we've ever gone. But it is a challenge when we're literally seeing people who are exposed one day and 2 days later they're not just testing positive, they're already transmitting to other people. And so there is an element that contact tracing cannot reach because those people can only be identified when that, the person who's transmitted to them has tested, been confirmed and had their close contacts identified. So the lockdown does its job of limiting the other exposures of those primary close contacts. They are working in concert.
Professor, there was a security breach at the airport on Wednesday night where a mystery passenger from the Sunshine Coast did a runner, and the department's still trying to identify that person, actually find them. Where are you at with that situation?
I'm not up to date with that. I don't know if Jerome or the Minister have anything on it. We can update, maybe. Yeah.
So I'm certainly aware.
A broader question about the New South Wales and Sydney situation. Given that there will still be movements of people between states at some level, how important is it for them to get their stuff sorted and get their rates down? Otherwise, are we just going to see rolling risks of other outbreaks and lockdowns in Victoria?
Well, we've always said any jurisdiction's issue is the country's issue. We have nothing but solidarity with the health teams in New South Wales, with the people of New South Wales. Of course we want them to succeed in this. The risk will be across Australia when there are active cases in the community anywhere in Australia and those essential movements of people. And so yes, to the extent that New South Wales drives numbers down, that will be a benefit to Victoria. The risk will remain everywhere until that community transmission can be driven right down.
Are you concerned about modelling that's showing that it could run into the thousands of cases, though? The Sydney Uni modelling and others that are showing that on the current trajectory things could get a lot worse in New South Wales?
Look, I understand the settings have changed recently in New South Wales, so that may change that trajectory. Modelling has always been of use to us. It's one input. that the New South Wales government will take account of. But of course, we want this to run down as fast as it possibly can be. And if there's additional measures that the New South Wales government is considering, it's a matter for them. But of course, we want them to succeed in it.
They've just shut down construction sites, Professor, and I think tightened eligibility rules around essential work. Is essential work and other kind of sites and areas in Victoria that are open and still operating, are they posing a problem for us at all?
I don't believe so. We've got very tight restrictions at the moment. That essential work list is small, and it does relate to essential work. The primary transmission that we've seen still relates to kind of the pre-lockdown phase, and it is those indoor hospitality and sporting venues, but also in the schools that I've mentioned. So it's those households, those other indoor settings that will be the primary risk. But as we identify all of those primary close contacts, we can contain some of those sites. So, you know, we are trying to reduce the risk of someone unwittingly going to any one of those essential work sites to transmit the virus. We also know from experience that Victoria is very well placed in terms of those COVID-safe measures. So whether it's construction, whether it's any other essential industry, the use of PPE, the use of QR codes, the use of really good records is a terrific measure for us to be able to chase something down if possible.
The Minister in his preamble, I think, talked about going harder if we needed to. What could that entail?
I couldn't speculate on it. We would, as we always do, we will reflect on, you know, gaps that might emerge should we see something with respect to transmission that isn't managed by current settings. But you know, that's again a day-by-day prospect.
We are supposed to open up, and I know it is a day-by-day prospect, but Victorians aren't silly. What is your message to Victorians that there is every chance this is going to go on for a little bit longer?
Look, there's enormous frustration for all of us, absolutely everyone in Victoria, around the uncertainty with this virus. But you know, you might as well read a horoscope to be able to predict how things might look 3 days from now. We're on a really good trajectory in terms of having every case linked, but we don't know what's around the corner necessarily. Those super spreading events are becoming more common with the Delta variant. The transmission within any kind of indoor setting is much higher than we've seen previously, and the same for households. The fact that we're in lockdown changes that risk of further cases being out and about. But it only takes one essential worker who has to be out and about, you know, that we might have another super spreading event. So we just need to brace ourselves for any possibility. We are doing the best that we possibly can given the circumstances at the moment. But, you know, I need to ready myself. Every Victorian needs to ready themselves for what might emerge over the next 24, 48 hours. All I can say is the response couldn't have been better. The judgments that have been made around a hard and fast lockdown have been the right ones, and that's got us on a good track. And it is, without question, a better situation than would have been the case without a lockdown.
But infectious disease experts have indicated at this stage that we cannot open up under the current numbers. So,
well, we're not opening up under the current numbers. We've got settings in place until Tuesday midnight, and we'll make another assessment every day over the next 3 days.
I've just got a question back on the borders. Sorry, just going on from essential workers. So look, it's unfortunate we've had this outbreak. What do we know about other essential workers crossing the borders? I mean, there's a possibility this can happen in any circumstance. So is there any type of policing for other sectors, and also what does this mean for anyone trying to move into state?
Well, certainly for our hospital sector, there are requirements for anyone who's working in COVID wards or who might be in contact with suspected COVID patients. Those testing requirements will be in place in New South Wales for those essential workers who might need to come down to Albury, Wodonga, for example. So there are a number of measures. There are, of course, those attestations for healthcare and aged care workers who need to say that they are symptom-free, so that's another measure in place. But you can't reduce the risk in essential workers' movements down to zero. They do need to move around, but it's been minimised to the fullest extent possible. And we, again, urge individuals who are symptomatic not to turn up to work regardless of their essential work status. And there are those additional requirements for the freight workers for regular testing. We also know that New South Wales has embedded now the regular testing for various local government areas and essential workers, so that'll be another mitigation for those who might need to move out of Greater Sydney.
How can we better police that, I suppose? Because there's a testing every 3 days. Is there anything we can do to really get on top of it before this outbreak, you know?
Oh, look, I don't know that you can do anything more than check everyone who's arriving from red zones for essential reasons. We've got a compliance and enforcement unit overseeing those red zone arrivals in Victoria. They're getting the messages. We're reinforcing that every day about the fact that quarantine, when you've come from a red zone, it's not the same as lockdown. It's stricter than lockdown. It is absolutely staying at home for a 14-day period and not going out for any reason other than absolute emergencies. So all of that is part of managing that risk. You can't check 10,000 homes face-to-face every day, but we are checking a number of homes with visits to make sure that people are complying with those requirements. And people have seen what happens when you don't comply with really strict quarantine arrangements. Transmission occurs and we're chasing down another chain.
So, Professor, can we confirm that red zone workers, specified workers, are able to go out shopping for medical supplies and for food?
Look, I've been on leave. I haven't seen the directions in detail as they've been written in the most recent iteration. I don't know if Jerome can update.
Sorry, Professor, before you do leave the lectern, just a quick one. The 43 people who are in hospital, not in hospital, are any in hospital in the 43 in the current outbreak?
There are none. Thank you.